Okay, for the anatomy, you have the thalamus in the middle, corpus callosum here, lateral ventricle, tentorium, fourth ventricle here, and medulla oblongata, the genu of the corpus callosum anterior and the splenium posterior, cerebellum and pons, frontal sinus here, caudate nucleus, lentiform nucleus. This is third ventricle here, and thalamus. Anterior horn of the lateral ventricle and posterior horn of the lateral ventricle with basal ganglia. Maxillary sinus and sphenoid sinus. Here you have the internal carotid. You have the seventh cranial nerve, the cochlea, and the semicircular canal. You have medial rectus and lateral rectus. So your right lens, left lens. This is the optic nerve, the globe. Internal carotids are here, pituitary gland and pons. Genu of the corpus callosum, caudate nucleus, internal capsule. You have white matter here, lentiform nucleus, and then grey matter. Corpus callosum's here, sagittal sinus, fornix, lateral ventricle again, pituitary gland, and internal carotid. Circle of Willis, so here you have the vertebral artery and the basilar artery there. Internal carotids, posterior cerebral artery, middle cerebral artery, and anterior cerebral artery. Here on the carotids you have the vertebral, and then the common carotid artery, go into the internal carotid and external carotid. So the vertebral artery supply the posterior brain, the common carotids which bifurcate at C3-4. The internal carotid supplies the blood to the anterior brain, and the external carotid supplies blood to the face. So vertebrals go posterior, internal goes anterior brain, external goes face. Here you have a TMJ, so you have articular disc with the articular tubercle and mandibular condyle. Here you have the sagittal MIP, you have anterior frontal vein, posterior frontal vein, parietal veins, superior sagittal sinus, internal cerebral vein, basal vein or Rosenthal brain, torcular hieropili back here, vein of Trollard, left parietal vein, right parietal vein, superior sagittal sinus, right transverse sinus, left sigmoid sinus, internal jugular, and torcular hieropili. Here you have the superior sagittal sinus again, right transverse sinus, left transverse sinus. For the carotid, so you have the thoracic aorta, the brachiocephalic coming here, right subclavian and left subclavian. And then here you have the left vertebral artery, and this will be the right vertebral artery. Right subclavian artery again, so you have the right carotid. Here it's going to split to the right internal and right external. Left vertebral, left common, left external artery is right there, and internal. Vertebro-basilar junction right up here, where the vertebrals join to the basilar artery. So white matter, grey matter, you have the thalamus here, caudate nucleus, internal carotids, straight sinus, lateral ventricle, sulcus or sulci, fourth ventricle, cerebellum. Here you have the genu again, so superior sagittal sinus, cerebral peduncle, frontal sinus, pituitary gland is here, pons, uvula, vein of Galen at the back. You have the inferior caniculus of the midbrain, the aqueduct of Sylvius between third and fourth. Body of the corpus callosum, splenium, thalamus is here, optic chiasm, cerebellum. Fourth ventricle again, cerebellum, posterior arch of C1. You have the spinal cord here, CSF. Anterior longitudinal ligament right there, and posterior longitudinal ligament behind. Venous plexus. Spinous ligament here. So here you have a transverse process, spinous process, and the vertebral artery. Cerebral spinal fluid, CSF. Vertebral body. Here's the ventral nerve root and dorsal nerve root. Lamina coming back with the spinal cord again. Here we have the spinal cord, the ligamentum flavum back here. Spinous process, suprasternal notch. Intervertebral discs with sternum. CSF. You have a vertebral body. A zygous vein right there, descending thoracic aorta. Spinal cord with CSF. Here's lamina and spinous process. Disc space here, the HNP. Vertebral body is S1. Here you have the abdominal aorta and inferior vena cava. Intervertebral disc. Spinal canal. Facet joints are right there. You have spinous process with lamina and superior articular process. Psoas muscles are here. Lamina, spinous process, intervertebral disc space. You have a pedicle coming back there and a nerve root right there. Vertebral body, facet joint or zygapophyseal joint. CSF, erector spinae muscle at the back. So you have cerebellum with the pons, you have C3 right there, spinal cord coming down, CSF around, suprasternal notch, there's T7, spinous process, T12, intervertebral disc, and S1. Onto the shoulder you have the supraspinatus tendon, and here's the acromion there. Coracoid process, deltoid muscle here, infraspinatus tendon, supraspinatus muscle, head of the humerus, subscapularis muscle, glenoid, infraspinatus muscle, anterior labrum and posterior labrum, head of the humerus, biceps tendon. You have acromion, deltoid, infraspinatus muscle, teres minor, spine of the scapula here with acromion, infraspinatus tendon and deltoid muscle, spine of the scapula, and here's the scapula, glenoid, supraspinatus muscle, acromion, supraspinatus tendon, greater tuberosity, clavicle here, AC joint, acromioclavicular joint, supraspinatus tendon, biceps tendon. Here you have the clavicle, SC joint, sternal notch, up to the acromioclavicular joint, and scapula, the right lung with the vertebral body. Sternum here, Clavicle again, SC joints, acromion, right there, humeral head, coracoid process. Onto the elbow, you have the triceps muscle, triceps tendon, olecranon with fatty tissue, humerus, this is the lateral epicondyle, so right elbow, medial epicondyle, and the ulna. Humerus, radial head, radial tuberosity, common flexor tendon. Here you have the lateral and medial epicondyles, the ulna at the back, anconeus muscle, triceps brachialis, trochlea, olecranon here of coronoid process, So flexor tendons of the wrist, the median nerve, you have the hamate with the hook, capitate, trapezoid, trapezium. Here's the radius and ulna, scaphoid, lunate, triquetrum. You have base of the second metacarpal here, trapezoid, capitate, hamate, and this is base of the fifth metacarpal. So we have radius here, triquetrum, capitate, base of the second, base of the fifth, head of the metacarpal, metaphalangeal joint, interphalangeal joint, base of the second middle, head of the second proximal. You have the iliac crest, body of the ilium, femoral head, greater trochanter and the femur, vastus lateralis here, an abductor muscle here, obturator externus, again femoral neck, labrum, and acetabulum, left femoral head, acetabulum, labrum, bladder, superior pubic ramus, right femoral head, and ischium. On the knee you have the right femur, patella, vastus medialis, sartorius down here, articular cartilage, intercondylar fossa right there, lateral epicondyle, medial epicondyle, medial condyle, lateral head gastrocnemius, medial head of the gastrocnemius, lateral patella retinaculum, anterior cruciate ligament, medial retinaculum, posterior cruciate ligament. Here you have a lateral collateral ligament and medial collateral ligament, medial femoral condyle, lateral meniscus, tibial plateau, medial meniscus, posterior horn of lateral meniscus, anterior horn of lateral meniscus, femur, patella, tibia, head of fibula, quadriceps tendon, patella, patella tendon, distal femur, posterior cruciate ligament, and tibia, tibia again, Achilles tendon at the back, the talus, calcaneus, calcaneus again, Achilles tendon, peroneus longus tendon, cuboid, lateral cuneiform, intermediate cuneiform, medial cuneiform. You have the cuboid bone, base of the fifth, head of the fifth, proximal phalanx, shaft of metatarsal, head of the third metatarsal, head of the first, and a metatarsal phalangeal joint. Navicular cuneiform, base of metatarsal, head of metatarsal, proximal phalanx, proximal interphalangeal joint, middle phalanx, distal interphalangeal joint, and distal phalanx. Fibula calcaneus. You have tibia medial malleolus. You have talar fibular joint, subtalar joint, lateral malleolus, talus and tibiotalar mortise joint. Stomach, spleen, left kidney, vertebral body, liver up here. Spleen, liver, right kidney, left psoas and cerebral spinal fluid. This is pancreas here, abdominal aorta, liver, right kidney, vertebral body, left kidney. Here you have the splenic artery. You have the right renal artery, left renal artery, right kidney, and you have the aorta abdominal. You have the right renal artery here, distal branches of superior mesenteric, left external iliac, left renal abdominal aorta bifurcation, common hepatic artery, splenic artery, right common iliac artery there, abdominal aorta, superior mesenteric arteries, right internal iliac, stomach here, right lung, liver, spleen, left kidney, descending colon. You have small intestines, cerebral spinal fluid. Here's your psoas, ascending colon. Again, liver, stomach, small intestines, gallbladder, iliac crest, sigmoid colon, bladder. Cervix right here with fornix at the back and uterus, bladder, symphysis pubis. So here's the gallbladder. Goes to common hepatic, which goes to left and right hepatic. Then this comes to common bile duct, CBD, and pancreatic duct. Pubic symphysis, prostate gland, rectum, the femoral head, seminal vesicles here, prostate gland, bladder. Mammary duct, you have the areolar nipple, pectoralis muscle, the liver. Mammary ducts, chest wall, breast implant, and lung. Left common carotid artery, right axillary vein, right pulmonary arteries, and here's the heart. Right common carotids again, descending aorta, right subclavian, right axillary artery, left jugular vein, left axillary artery, and here's spleen, left subclavian, brachiocephalic artery, aortic arch, and ascending aorta. So here we have the right renal artery here, abdominal aorta, coming down to the left common iliac artery, and then left internal iliac artery, right external iliac artery, lateral circumflex artery, right femoral artery, left popliteal artery, coming on down to the fibular or perineal artery there, left posterior tibial artery, right anterior tibial artery, dorsalis pedis artery, right plantar artery. So here's phrenic artery, suprarenal, celiac trunk here with the left gastric, also common hepatic artery and splenic artery there, suprarenal, left renal and right renal, then the superior mesenteric, gonadal, this is the aorta, coming down to the left internal iliac. This is the right common before it's right external and right internal. Cranial nerves now, so nerve 1 is right there. Optic nerve, nerve 2. 3, oculomotor on the left. 4, left trochlear is back there. Right trigeminal 5th is there and there. Right abductans nerve for 6 and left. Right facial nerve. Left vestibulocochlear nerve for the 8th. Right glossopharyngeal nerve for 9. 10th is the vagus nerve. 11 is the spinal accessory nerve. And 12 is right hypoglossal nerve. Vertebral arteries coming through the spine here. Internal carotids. So some pathology here, acoustic neuroma. You can see there. Kyrie malformation. So red is the malformation and blue is the syrinx associated with that. Multiple sclerosis. So here is the right atrium and the left atrium. Left ventricle, right ventricle, and descending aorta. Interventricular septum. Myocardium here, papillary muscles. Right ventricle, left ventricle. Left ventricle is here and right ventricle is here. Left ventricle, right ventricle, lung, myocardium. So we have the right atrium tricuspid to the right ventricle, ventricular septal wall. Left atrium mitral valve, left ventricle. This is descending aorta. This is the apex. So apex here, apical, midplane, basal, and mitral valve, pulmonary vein. Again, here's just some more anatomy. So tricuspid is here, semilunar valve, mitral valve or bicuspid is here.